AVA, as well as the lead of the AVA webinar series. In addition to that role, I'm the Associate Director of the Frida Center on Violence Against Women and Children. And today, I'm here as your host. We are so grateful for Dr. Souheir Jamil to be joining us from the University of Calgary Sexual and Gender-Based Violence Prevention and Support. She will be presenting on the topic of responding to disclosures of sexual and gender-based violence in newcomer and refugee communities. This webinar today is a collaboration between the AVA webinar series and Resolve Alberta. And the focus through this webinar, our presenter will focus on newcomers and refugees who face numerous challenges as they adapt to their new environment. In addition to the stress of displacement, a history of sexual and gender-based violence can make them particularly vulnerable, often discouraging survivors and victims from seeking help. This webinar aims to help you understand the challenges and provide you with the tools to respond to disclosures with these communities. Our speaker today is a specialist in sexual violence, an experienced curriculum developer, and a trainer who delivers impactful psychoeducation programs on sexual violence, trauma recovery, and cultural sensitivity, with a post-secondary education background as a professor at Lebanese University. Without further ado, I will hand it over to our speaker. Thank you so much for joining us today and sharing your wisdom.
Okay, thank you, Sarah, and thank you, everyone. So hello and welcome. I'm so excited to be here today and appreciate everyone attending this presentation on responding to disclosures within newcomer and immigrant communities. So first, I would like to say that sexual and gender-based violence is a significant issue in our society, and discussions about this topic can be sensitive for some individuals. So it's very essential to prioritize your well-being during this conversation. So please feel free to step out, take breaks, or use any self-care strategies that are effective for you. If you need support, I will be available for a while after the presentation for anyone who would like to talk or debrief. We'll start our presentation with a land acknowledgement. On a national level, we encourage all Canadians and visitors to Canada to learn about the Indigenous people of the lands on which they live, work, or visit, and become engaged allies together. We, as Canadians, in the spirit of truth and reconciliation, respect the self-determination of First Nation, Métis and Inuit. Sorry, what I did. Okay. I don't have to touch anything. So Métis and Inuit and their rights and responsibility in cultures, language, and the pursuit of wellness. The AVA Health Research Training Platform is located at the University of Calgary in the heart of Southern Alberta. Both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Brispa, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta District 5 and 6. So this presentation is divided into three parts. The first part provides context regarding sexual and gender-based violence. The second section discusses the factors that increase the vulnerability of newcomers to sexual and gender-based violence. And finally, the last section addresses how to effectively respond to disclosures of such violence within the community and concludes will end with a summary. At the end of our time together, you will be able to define sexual and gender-based violence in the context of a newcomers concept. List at least two factors that increase the vulnerability of newcomers to sexual gender-based violence, identify two strategies for responding to disclosure, and list at least two barriers to disclosure. Before we begin, I would like to outline the framework of this presentation and what you can expect. Since the topic is not new and has been discussed widely, the framework will focus on understanding sexual and gender-based violence within the newcomer community and recognizing the unique challenges that newcomers face. And when I say newcomer, it means like newcomer, immigrants, and refugees. And we'll focus also about adapting existing frameworks and response protocols for disclosures within the newcomer communities in a way that involves their specific factors related to their experiences, and finally, identifying ineffective practices that require adaptation. As I mentioned earlier, this presentation focuses on newcomers and immigrants in Canada. Why is this group significant to our country? You know, Canada has a long history of immigration. Millions of people worldwide have chosen and continue to choose Canada as their new home. Immigrants have made up the largest share of the population in over 150 years and continue to shape who we are as Canadians. According to the 2021 census, more than 8.3 million people, or almost one quarter, it means like 23% of the population, were or had either been a landed immigrant or permanent resident in Canada. And 1 in 4 people counted were or had been a landed immigrant or permanent resident in Canada. It's important to note that these figures do not fully represent the reality of the immigrant population. They exclude protected persons, such as asylum claimants, who have yet to obtain permanent residency. These individuals have sought refugee status in Canada and await a decision on their claim. It means they are not permanent resident yet. And, you know, immigrants come from various countries, bringing their unique culture, ethnic, linguistic, and religious heritages, personal experiences, and histories of trauma. They contribute to the economy and help make Canada one of the most cultural, diverse countries in the world. However, it's crucial to provide these newcomers and refugees with the necessary support to aid their integration into Canadian society. This support can help reduce anxiety and facilitate their resettlement. In this presentation, we will discuss one specific type of support, assistance for survivors of sexual and gender-based violence. So, because, you know, everyone has the right to live free for violence. However, many Canadians across the country continue to face violence every day because of their gender, gender expression, gender identity, or perceived gender. Both women and men experience gender-based violence, but the majority of victims are women and girls. In all cases, sexual and gender-based violence is a public health issue and a violation of human rights. It's also like, you know, sexual gender-based violence is prevalent in all societies. In the next slide, we will watch a video that illustrates that in numbers, through 16 statistics done by Global Citizen, a social action platform aimed at empowering a global generation to tackle the world's most pressing challenges. The video lasts 2 minutes and 42 seconds, and let's watch it together. And I want to remind you to take any necessary self-care steps if this video brings up any difficult feelings. So for sure, those numbers are not pretty. So you can see this short video presented statistics and raise awareness about the devastating impact of all forms of gender-based violence, including sexual assault used as weapon of war. It concludes with a hopeful message about the potential for change. So our presence here today demonstrates our commitment to actively engage in this transformation and contribute to this change. Okay. According to the Alberta government website, 2 in 3 females and 1 in 3 males in Alberta have experienced sexual violence at some point in their lives. Additionally, certain groups of Albertans face an even higher risk of experiencing gender-based violence. These groups include, but are not limited to, women and girls aged 15 to 24, Indigenous women, and girls, Black and racialized women and girls, immigrant and refugee women and girls, individuals with disability, and people who identify as 2S LGBTQQII+, women and girls living in northern, rural, and remote communities. As noted, immigrant and refugee women and girls are at higher risk of experiencing gender-based violence. Before we begin our presentation and discuss the factors that make immigrant and refugee women more vulnerable to sexual and gender-based violence, let's first look at the general definition of sexual and gender-based violence. Sexual and gender-based violence means any violence, physical or psychological, that is committed, threatened, or attempted against another individual without the individual's consent by targeting an individual because of their gender identity, gender expression, or sexual orientation. It can include a single incident or a pattern of behavior, whether in person, online, or via other means. Sexual and gender violence is a serious form of gender-based violence that is a significant issue, not only in Canada, but also around the world. Anyone can become a target of sexual and gender-based violence, regardless of age, gender, race, ethnicity, sexual orientation, sexual history, or social class. There is no typical victim. Often individuals who experience sexual violence know the person who has assaulted them. It can occur between individuals in romantic or dating relationships, within families, at work, among friends and acquaintances, or even among strangers. All sexual and gender-based violence is rooted in attitudes and beliefs that lead some individuals to devalue particular groups of people, believing themselves to be superior to this group, and the violence is a crime driven by power and control. It's never truly about sex. Instead, sex is used as a tool to exert control over another person whom the perpetrator devalues. Those who use abusive behaviors believe that it's their right and within their power to use sex as a means of controlling those they do not perceive as equal. Some other facts about sexual and gender-based violence: the individual who experiences the violence is never responsible. It's a choice made by the person committing sexual violence. It's a social and systemic issue that is rooted in oppression. As a result, individuals impacted by this violence may experience significant short and long-term consequences. They may face physical, emotional, or mental health issues that can lead to harm or suffering, especially when there is a lack of support. What factors could influence the impact of sexual and gender-based violence on an individual? The individual traumatic event history, age when abuse was experienced, and the relationship to the person who chose to abuse them, and repetition of the violence and type of behaviors involved. So now we will have a look about the definition of different types of sexual gender-based violence, but in the context of newcomers community. So sexual assault, it's one person, any unwanted sexual act to another or sexual activity without one person consent or voluntary agreement. Okay, I'm so sorry. So empirical studies show high victimization rates among undocumented migrant, asylum seekers, and refugees during transit and in destination countries, with vulnerable groups facing the most significant risk in this category of form of sexual gender-based violence. For example, female asylum seekers traveling to Europe during the 2015 refugee crisis faced significant gender-based violence, including forced transactional sex and coercion from smugglers. Sexual violence is widespread in refugee camp and at border crossing. The International Rescue Committee reported that nearly all the women interviewed has experienced or witnessed such violence. It's essential to emphasize the various forms of sexual violence that women refugees may encounter, particularly in conflict situations. One significant issue is the use of sexual assault as a tactic to exert control over communities and instill fear. Unfortunately, this type of violence has been employed as a weapon in many conflicts around the world. In these crisis areas, sexual violence often serves to intimidate individuals, punish families, disrupt social structures, and even attempt to alter the ethnic composition for future generations. Additionally, there are alarming instances where women are deliberately infected by HIV or made unable to bear children. It's crucial to raise awareness of these severe issues when supporting community members. Another form of sexual and gender-based violence, sexual harassment. And it's a form of discrimination based on gender, which is prohibited under the Alberta Human Rights Act. And sexual harassment is any unwelcome sexual behavior that adversely affects or threatens to affect directly or indirectly a person's job security, working conditions, or prospects for promotion or earnings, or prevents a person from getting a job, living accommodation, or any kind of public service. Sexual violence in the workplace against immigrants and refugee women is a serious issue. Immigrant and refugee women consistently reported experiences of sexual harassment alongside racial discrimination and exploitation, including unequal pay and unsafe work environments, both physical and psychological. Many reported their experiences were not recognized as systems address these instances of abuse separately rather than as interconnected problems. Sexual harassment directed at these women can stem from harmful stereotypes surrounding masculinity and femininity and behavior that promote aggression and disrespect toward women, coupled with racist attitudes, which can further devalue immigrant and refugee women. Immigrant and refugee women often doubt that reporting abuse will help them, fearing negative professional, financial, cultural, or social consequences with little chance of a positive outcome. Another form of sexual and gender-based violence is intimate partner violence. And that refers to behavior within an intimate relationship that causes physical, sexual, or psychological harm, including acts of physical aggression, sexual coercion, psychological abuse, and controlling behaviors. This definition covers violence by both current or former spouses and partners. The prevalence of intimate partner violence in immigrant and refugee community is not known. I tried to bring numbers. So, but finding regarding intimate partner violence rates among immigrant women have been inconclusive. Community-based studies indicate that there are high rates of abuse among immigrant women. In contrast, several population-based studies from Canada and the US suggest that intimate partner violence rates are lower among immigrant women compared to non-immigrant women. And this inconsistencies as prevalence rates can be attributed to various factors, including differences in measurement methods and access to resources. Immigrant and refugee women face many of the same types of intimate partner violence as other women, but also additional types of violence, such as immigration-related abuse through threats and violence by their partners. And I will explain what that means. For example, immigrant women with status can face manipulation by their partners in ways that are tied to their newcomer experience. For example, they may be prohibited from learning English, French, or working further, isolating them. Non-status women face also extreme vulnerability as they do not have any legal status. They are more reluctant to call the police, or they fear deportation and the loss of their children. The refugee claimant women may not be aware that they can separate their refugee claim from their abusive partner during the refugee process. Their partners may tell them that they can only receive refugee status if they remain in the relation. So, and also immigrant women may be more at risk for emotional abuse by an intimate partner due to their transition into not only a new environment like all newcomers, but also navigating a new country and immigration status, language barriers, social and cultural differences, and a possibility of substandard life condition. Also, there is another form of intimate partner sexual violence is honor killings, which are carried out by men from immigrant communities against female family members. And these acts are often justified as a means of restoring honor to the family. Regardless of the justification provided, the killing of a woman or girl should be considered femicide. Sex trafficking is a form of human trafficking that involves recruiting, moving, or holding victims for sexual exploitation purposes. And sex traffickers can coerce victims into providing sexual services by force or through threats, including mental and emotional abuse and manipulation. Unsafe or irregular migration routes increase the risk of gender-based violence, including human trafficking. So during their journey, some migrant women and LGBTQI individuals and transgender people face situations where they are more vulnerable to sex trafficking. And we have a lot, but we are not going to all definitions. What factors increase the vulnerability of newcomers and refugees to sexual and gender-based violence? For some women, migration can empower them through higher income, assessed ownership, improved self-esteem, and greater autonomy. However, it can also expose them to risks such as discrimination and exploitation. Additionally, migration may offer women and girls a chance to escape gender-based violence in their home countries. So migration outcomes can be both positive and negative, depending on individual circumstances. The decision to leave one's country, like I'm an immigrant myself and I know what it does mean. The decision to leave one's country, family, home, and memories is not easy. Some immigrants premeditated in advance and planned for their migration to a new country. It was my case. Immigration was their choice, but they still had to face various challenges that sometimes impacted their decisions to settle permanently in the new country. In other cases, people are forced to move to escape dangerous situations. If they do not cross international border, they are considered internally displaced people. As a result, immigrants might experience various types of trauma throughout their journey. This can include immigration-related trauma, as many individuals may have faced traumatic experiences before they moved, which could have influenced their decision to leave their home country. Additionally, they may encounter trauma during their travel and transit, as well as their final destination, where they often face barriers to accessing basic services. Challenges with settling and integrating can also cause trauma. Immigrants might struggle to assimilate into their host culture with racism, exclusion, isolation, and discrimination, and poor living and working conditions. They should face loss of identity and familiarity, lack of tools or resources to cope in a new environment, uncertainty and lack of stability, which could be reflected in some factors and could play a role of increasing their vulnerability to sexual gender-based violence. So these factors are
I left.
Language barriers. Limited proficiency in English or French often isolates newcomers and makes it difficult to report sexual and gender-based violence. Or access resources. Language barriers hinder communication with law enforcement, legal aid, and healthcare providers, potentially leaving victims trapped with limited options to disclose or escape abuse. And this increases their isolation and limit reporting. Also, difficulty understanding right and service without clear information and their rights available service, newcomers may feel they have no protection. This can make it easier for abuser to manipulate or threaten them into silence, especially if the abuser speaks French or English while the survivor does not. Employment and economic challenges. Many newcomers face difficulties securing stable employment, often working in low-wage jobs, and this economic vulnerability increases their dependence on abuse partners, making it harder to leave. Refugee women and those with uncertain legal statuses face significant economic challenges, often lacking the financial resources needed to support themselves if they leave a sexual and gender-based abusive relationship. Housing and accommodation, risk of homelessness. The high cost of housing and limited affordable option for some newcomers to remain in abusive situation rather than face potential homelessness. Overcrowded or shared housing, we can see this a lot with the newcomers, also increases vulnerability to harassment and abuse within living environments, especially for refugees who may be placed in temporary shelters or transition housing with minimal privacy. Some shelters may not be culturally appropriate or may lack multilingual staff, making it difficult for immigrant and refugee women to seek refuge and feel safe if they decide to leave an abusive environment. Health and access to healthcare. Newcomers, especially refugees, may have experienced trauma pre-migration, as we mentioned earlier. However, limited access to culturally competent mental health services prevent them from receiving the care they need, increasing the risk of further victimization and making it harder to recover from sexual and gender-based violence. And without knowledge of the healthcare system, newcomers may struggle to find our access, support for physical injuries, or mental health concerns related to this violence, allowing issues to go undertreated and compounding their vulnerability. Social isolation and cultural adjustment. The social isolation is very common for newcomers. particularly for those who arrive without family or community networks. Abuser may leverage this isolation to control and manipulate their partners, using threat of ostracization or even deportation if the survivor speaks out. Culture and belief and stigma around sexual violence may prevent survivors from reporting abuse, as they fear being shamed or blamed by their community. In some cases, survivors may even feel responsible for the violence, which can deter them from seeking help. Navigating legal and immigration system. Survivors who rely on their abuser for immigration sponsorship may fear deportation, as we said, if they report abuse. And legal system complexity and the risk of losing their immigration status make it difficult for survivors to feel safe reaching out to authorities. Previous experiences with corrupt or ineffective justice systems in their home countries may also prevent immigrant and refugee survivors from seeking help. This can lead to a lack of engagement with law enforcement, making it easier for abusers to continue the cycle of violence without fear of repercussions. Discrimination and social prejudice. Discrimination based on race, ethnicity, or immigration status can discourage survivors from seeking services, fearing they may face bias or inadequate support from authorities and social services. This fear compounds their isolation, further entrenching vulnerability. And experiences of discrimination can make newcomers hesitant to trust or utilize available support services, increasing the likelihood that sexual gender-based violence remains unreported and unaddressed. Disclosure. Disclosing refers to a survivor, victim, like survivor or victim, sharing or revealing their experiences of abuse, of the violence, or trauma to another person. In a published research study on sexual and gender-based violence, the UN Refugee Agency highlighted that the concept of disclosure requires more nuanced thinking to enhance service provider responses in various contexts. To illustrate the difference between disclosure, the individuals involved, and the condition under which it occurs, and they could be categorized as follows. First, self-motivated disclosure. It means the survivor has independent reasons or intent to disclose sexual and gender-based violence, regardless of the environment or actions taken by providers or by supporters. Second type is enabled disclosure. The survivors feel encouraged to disclose sexual and gender-based violence due to the presence of a supportive environment or a general display of receptivity from the provider. Third type, probe disclosure. The survivor discloses information in response to direct questioning by providers about past traumatic experiences, which may include specific inquiries about sexual and gender-based violence. As responder ourselves or service providers working with the newcomer and refugee communities, we should be prepared for voluntary disclosures, which are self-motivated disclosures, even if they are rare. We must be equipped to provide psychological first aid and primary care where referrals to medical, psychological, or legal support are not what the individual disclosing needs. And it's very important to clarify the difference between disclosing and reporting for the newcomer survivor. Many survivors may believe that disclosing information to you or to us constitute a formal report, and they might expect that the person who has harmed them will be punished or removed from the situation. When this does not happen, they may feel frustrated, disappointed, and lose trust in the process. The next slides will focus on responding to a self-motivated disclosure. Using specific strategies when responding to sexual and gender-based violence within newcomer communities is crucial because these communities face unique challenges that influence their ability to access support and heal. So general approaches to sexual and gender-based violence may fall short when applied to newcomers, as they may not address their specific aspects. We'll take a moment to discuss some tailored strategies when responding to this community. Use an anti-racist and anti-oppression approach. Do not blame the client's race, culture, ethnicity, or religion for the abuse they are facing. This is not about rescuing the assaulted person from their culture. Understand their lived experiences. This involves listening to, respecting, and validate their experience. Examine your own biases, our own biases, assumptions, and behaviors to actively challenge and unlearn discriminatory mindsets. Oppression is often experienced differently by individuals due to intersecting identity. We must challenge racism and other forms of discrimination that also affect their lives. Racism is a common form of violence that is experienced by women from immigrant communities in Canada who are racialized. When looking at gender-based violence against immigrant and refugee women, it's critical to see the different ways in which racism and sexism intersect and influence their life. Many immigrant and refugee women experience violence and gender inequality in ways that are often connected to racism and discrimination. For example, this can manifest as public abuse directed at women wearing hijabs, the underpayment of migrant women working as domestic helpers, a high percentage of immigrant and refugee women in low-paying and precarious jobs, and instances of racially derogatory sexual harassment. Discrimination and fear of racism can hinder a woman's access to intervention and prevention programs, information, social network services, and support. Consequently, some women may feel less safe, less respected, and though they do not belong to the larger community. And this leads us to next point, intersectionality. Intersectionality is considering how multiple layers of identity the immigrant community members represents. Race, gender, immigration status, sexual orientation, socioeconomic status, education, religion, culture, ability, and many other elements interact to shape each survivor's experience of sexual gender-based violence and their access to support. If we don't know about one layer of these layers, we can educate ourselves, we can ask. Intersectional understanding helps address unique vulnerabilities without isolating these identities. For example, recognizing that a racialized immigrant woman may face both racial discrimination and gender violence allow us as responders to offer nuanced and relevant support. It's also crucial to acknowledge the different risk, vulnerability, and barriers that people face depending on different aspects of their identity. Another one, like the trauma and violence-informed approach, must be integral to all responses. It's essential to be mindful on how trauma affects individuals and to avoid re-traumatizing them. Many immigrants have experienced previous, recent, and/or ongoing trauma, which increases the risk for mental health issues, including depression, anxiety disorders, and post-traumatic stress disorder. Individuals who have faced violence and abuse may feel a loss of power and control over their lives, Even small gestures, such as non-judgmental communication and allowing service seekers to choose how much information they wish to share, can make significant difference. Creating a safe and trusting environment is vital, as it encourages people to share their experiences at their own pace. It's important to assume that any woman who comes through your doors may have faced violence and might have endured multiple traumas prior to their current situation, including surviving war or experiencing child abuse. Therefore, it's crucial to create safe spaces for immigrant and refugee women to connect, share, and heal with one another. And these spaces could foster peer support and be centered around activities like art, cooking, or other interests. Such environments provide important opportunity for relationship building, which can lead to disclosures of abuse and access to support services. Use a woman-centered approach. Take the lead from what she is asking for and what her immediate needs are, rather than imposing a plan of action. Address the holistic concerns of the women living with violence, such as income security and childcare. Carry out safety planning with the support of professional services so that the risk to the woman's safety can be assessed and support put in place. When referring a woman to a shelter, investigate whether the shelter is ready to accommodate her cultural needs and follow up around her experience at the shelter. Every survivor will be impacted differently and recover differently in the aftermath of sexual gender-based experience. So, services for survivors of violence must recognize the impact of a person's identity on their experience and center the unique needs of that marginalized group. Identify the family dynamics and laws specific to immigrant and refugee communities. In some families, culture or traditional gender roles may dictate that one partner, and often the male, holds more power or authority within the household. When control is normalized as part of these gender dynamics, it can create an imbalance that makes it difficult for survivors to speak out or leave abusive situations. And this difficulty may arise from fear of retribution, financial dependency, or social stigma. Also, disclosure can come from a friend, a client, or someone else in your life who belongs to newcomers or refugee communities. So you can receive disclosure like at any time. You don't have to be a professional or frontline helper. So you might have in your social network, and then they have a background of immigration. If someone discloses to us, it's common to feel uncertain about what to do or say. We don't need to be expert, and this is very normal. Like even myself, I have been in the field for many years, and every time it's hard, and like to hear and to listen to a disclosure. We don't need to be expert. The critical role here is to support them through the disclosure process and help them access additional support and resources by following these three fundamental principles: listening, believing, and supporting. The following slides will explore in detail these principles. Listen. Newcomers, not you listen, like listening. Newcomers, particularly refugees and immigrant newcomers, may be more inclined to share personal details about their experiences based on their culture. This tendency can be attributed to several factors, including cultural norms, backgrounds of trauma, and differing expectations regarding relationship with support responders or providers. In many cultures of newcomers, sharing personal stories is a common means of establishing connections and building trust. In some societies, individuals may be accustomed to openly sharing their experiences, especially with helpers, responder, to ensure they receive adequate assistance. However, given the concerns about re-traumatization, reassuring individuals that they have our support, regardless of what they choose to share, is crucial. It's important to explain that disclosing specific details may be re-traumatizing for them, and it doesn't mean that you don't want to listen to them, but for their good. It may be their first experience where someone genuinely listened to them without interrogation. So it's important to show genuine interest and empathy and use nonverbal cues like nodding or maintaining an open, relaxed posture to help them feel safe. However, a nonverbal gesture could also be interpreted as judgment, so we have to be careful. And I will give an example. For example, while eye contact is typically regarded as a positive and essential aspect of communication in many cultures, newcomers from repressive regimes or conflict zones may have internalized a need to avoid drawing attention to themselves. For refugees who have experienced persecution, making eye contact with individuals in positions of authority figures or caregivers, such as healthcare providers or sexual and gender-based violence specialists, can be intimidating. Direct eye contact may feel risky to them, especially if they fear discrimination, and it can create discomfort as it might be perceived as judgmental. So what I do normally before we start, like I ask them, is it okay if I can look at you direct in the face, or do you want me to look at any angle of the room, and whatever they make them comfortable, and explain to them, so it will be very beneficial. Avoid asking questions that could trigger post-traumatic experiences or investigations. If they wish to report something, when we explain them the difference between disclosing and reporting, and they want to choose the option of reporting, and we need information for this, okay, for that purposes, clarify that to them, like why you are asking those questions. And if you are a frontline helper, you can have this conversation in private space, avoiding distractions or interruptions, and the presence of other clients from their own community, because they would feel intimidated or embarrassed. I'm here to listen and appreciate you sharing what you have gone through. Saying that, this could highlight their bravery in disclosing their experiences and ease the social or cultural pressure they might experience. Be patient and allow the individual to set the pace of the conversation without interruption. This may be their first time disclosing sensitive information, and they might need to process many emotions at once. Discussing a taboo topic can bring up feelings of shame or guilt related to their experiences of abuse. Additionally, they may need to express themselves in a language that is not their mother tongue, which adds another layer to their emotional processing. You can say, take your time. I'm here as long as you need. Make sure to use the same language as the person when describing their experience or the individuals or group that harmed them. It might be upsetting for them if you label their experiences for them. Avoid overreacting by asking too many questions or showing emotions through facial expression. Listen with cultural humility. If you are unsure about your understanding, it's perfectly fine to say, what I hear you saying is blah, blah, blah. I might be wrong because I don't know enough about your culture. So please help me understand what you mean when you say that. Next, believe. Disclosing a sexual and gender-based violence experience for newcomer survivors can be very difficult due to their fear of not being believed or concerns about being blamed for what happened. These fears can lead to feeling of shame and self-blame. It's crucial for responders to understand the positive impact of responding with "I believe you" right away. One important message to convey is that the assault was not their survivor fault, regardless of the circumstances. Believing survivors can be conveyed through more than words. It includes our facial expression, tone of voice, word choices, and the question we decide to ask or not to ask. By affirming our belief in them, we position ourselves as supportive individuals in their life. So there are many, and you can see in the screen, like many ways to show that. The final piece of responding is support. Support ensures that survivors receive the assistance they need and help them regain control over their lives. Experiencing sexual violence often means that a sense of power has been taken away. And the experience of migration can create disorientation and vulnerability. For survivors of sexual and gender-based violence, these feelings are intensified, making their journey to regain agency even more complex. So it's essential to help newcomers who are survivors regain a sense of power that may have been lost during the violence they experienced. It's essential to encourage survivors to identify their next steps. Let them know that these steps do not have to be significant. Regaining control of their lives can start with a small step. Assure them that you are here to support them. And this support can empower them and help restore their sense of control. Addressing any immediate need should be the priority for someone experiencing domestic violence, child sexual abuse, or any other form of violence. Referring them to community resources can be beneficial, although some may hesitate to accept these referrals due to shame or intimidation. Ask them if they want that and have their consent before making referrals. Encourage them to get as much support as they need. Recognize existing support and acknowledge their strengths and bravery in overcoming immigration challenges, while shifting these skills to regain control and power in their lives. Barriers to disclosure and seeking support. I mentioned earlier that sexual and gender-based violence is considered sometimes as a taboo topic in some cultures, and people don't feel comfortable addressing it for many reasons. And this could be a main barrier to disclosing or seeking help. There are many barriers factors that don't encourage immigrants disclosing their experience of sexual gender-based violence. These factors are embedded in three key dynamics that are interconnected and are related to personal and psychological challenges faced by individuals who experience it, as well as broader cultural and structural factors. We can say there are three barriers categories. The first one, the interplay of power dynamics between victims and perpetrators. I will explain. Since sexual and gender-based violence often involves complex power dynamics that may prevent victims from disclosing their experiences, for immigrants or refugees, this power imbalance can create an environment of intimidation, of fear, or retaliation. For instance, if the person who chooses to harm them holds authority in the workplace, family, or social setting, they may worry about threats to their safety, job security, or social standing, leading to silence. The second barrier could be lasting consequences and the fear of disclosure, because disclosing can bring significant personal and social consequences for people who experience it, which may inhibit them from coming forward, such as fear of loss of children, apprehension, deportation, divorce, discrimination and racism within the service delivery system, unfortunately, limited knowledge about laws and rights, and domestic violence services, geographic, social, and cultural isolation. And differential understanding of victimhood. This is a very important point. Immigrants who have experienced sexual and gender-based violence may not understand what it means to be a victim, or who qualifies as a victim, or they may feel that their experiences do not align with typical narratives of or social definitions of sexual and gender-based violence. They may believe that because they did not fit a certain profile or experience sexual gender-based violence in a certain way, their experiences are less valid. This difference in perception can prevent individuals from seeking support, feeling that they do not have the right to disclose. And here the following factors fit under the 3 barriers category that I mentioned earlier: cultural norms and social stigma. Larger cultural and social factors could prevent immigrants from disclosing, and they don't have to share a private matter, or related to conservative cultural or religious environments in which sexuality or sexual violence are taboo, make it difficult for immigrant women survivors to speak about their experiences and lead them to fear being stigmatized if others were to discover what happened. In addition, if immigrant man has experienced sexual and gender-based violence, barriers to disclose will be very high because of the context of chauvinist cultural norms. Men are not supposed to be victims of sexual violence, and thus may not report violence due to extreme shame or fear of stigma. For lesbian, gay, bisexual, and transgender survivors, disclosure of sexual violence can be interconnected with disclosure of their sexual orientation or gender identity, fearing identity-based prejudice of the part of members of their community. They may be reluctant to disclose sexual violence or seek needed services. Also, it's more difficult for survivors to disclose sexual and gender-based violence if the perpetrators was a family member, due to both the rupture for a trusted relationship and the pressure from other relatives to remain with the spouse. This difficulty is in disclosure of sexual and gender-based violence also extended to community members, even including smugglers who came from the same hometown. Normalization of violence, which could be manifested by either the survivors may not see themselves as victims or recognize the sexual harm they suffered as violence due to the normalization and frequency of violence in the places from which they come. Trauma. Some service providers supporting refugees noted that trauma makes it emotionally difficult for survivors to open up about their experience. It may make survivors wish to forget about the experience or return home, particularly in the case of children. And remember when we mentioned at the beginning of the presentation about factors that influence sexual gender-based violence experience, such trauma history, age, and violence involved. The time was often cited as a barrier both to disclosure and the ability for follow-up. It can take time to open up about instances of sexual violence, and low levels of education and lack of awareness of rights and services. For some survivors, a low level of education may hinder their ability to understand the system, structures, and services available to them, which can inhibit disclosures. Fears related to direct consequences of disclosure, fears of victim blaming, or that her family will know, or partner, or children, or of retaliation from the perpetrators. Service providers' capacity and competence, and this is very important, lack of training of sexual and gender-based violence, difficulty feeling safe and comfortable talking or posing questions about sexual gender-based violence, an absence of female personnel, and a lack of private confidential space in which to speak about these issues could also inhibit survivors' willingness to discuss experiences of sexual and gender-based violence. It's important to note that every woman is more than her experience of violence, and to let the disclosure person to know that. Immigrant and refugee women informally support each other outside of social service structure. And immigrant and refugee women often have multiple language skill, and they can, like later, of course, like when they settled. And immigrant and refugee women develop creative ways to build community, become economically independent, and heal from their experiences of violence. And also, you can see many immigrant or refugee women leaders in the anti-gender-based violence movement. So they are more than the story or the violence that happened to them. Summary. It's very important because here you can relate it to the focus when I started the presentation. Understanding sexual and gender-based violence within the newcomer community requires recognizing the unique challenges they face during pre-migration, throughout their transit journey, and upon arriving at their new home. These challenges often mean that standard support method may not fully address their specific needs and tailor it to their experiences. To effectively assist newcomers, existing frameworks and protocols for responding to sexual and gender-based violence disclosures must be adapted to the to be culturally responsive. Frameworks should involve considering factors such as language barriers, cultural backgrounds, cultural norms and values, gender-based power imbalances, immigration status, trauma history, levels of education, and varying levels of trust in authorities. Without this adjustment, standard practices may be less effective or even counterproductive. Most services providers responding to sexual and gender-based violence here in Canada are already providing what works, such that they do trauma-informed and culturally responsive approach, because these approaches recognize the emotional and psychological impact of sexual and gender-based violence, which can be particularly intense for newcomers. Additionally, the culturally responsive approach can help bridge the gaps between responders, supporters, and the clients, like the disclosure, fostering trust and minimizing cultural misunderstanding. Also, the language support and accessibility and accessible information, like many professional provider, they interpret services, they provide interpretation services during intake, and counseling and legal consultations allows newcomer to fully engage with the services, making them more accessible for some their resources, from hotline services to informational pamphlet are available in multiple languages. They collaborate also with local immigrant and cultural organizations, knowing about how much this can enhance credibility and create pathways for newcomers to access services discreetly. Also, they have outreach initiative programs such as workshops or informational sessions at community centers, which can normalize discussions about sexual and gender-based violence and familiarize individuals with local resources. I can add here some recommendation. Since sexual and gender-based violence can be a very sensitive topic or a taboo, addressing the issue indirectly during parenting or health program may be beneficial, not like directly. What requires more effort? Things that don't work or things that need adaptation. Interventions had to not include initial relationship building. Interventions that do not include initial relationship building may fail because newcomers are often hesitant to share sensitive information with authorities or service providers without first establishing trust. So make the connection. The connection is very important. It's key to any relationship. This trust can be built through culturally matched counselors or by offering informal, non-judgmental introductory sessions to help become familiar with service providers. Cultural assumption can lead to misunderstandings and an oversimplified view of family structures within newcomers community. Understanding the complex family roles and power dynamics specific to each culture is essential for tailoring interventions in ways that are effective and respectful. While immediate interventions are critical, long-term support is often equally important for newcomers, like we don't see this very often. Important for newcomers who may lack familial and community networks. Services that do not provide continued support, such as safe housing or job training, can inadvertently leave individuals vulnerable to returning to abusive situation. Interventions that focus solely on sexual and gender-based violence without considering other contributing factors so may be less effective. Moreover, there is a lack of access to attendant care and sign languages interpretation for women living with disabilities and special needs group, with further limits their ability to seek help. So this point and this lack we have to take care of that in order to provide the adequate support for a newcomer. Now, the part it's very important, like briefly, self-care. Receiving a disclosure could be difficult for someone, and this is okay, because we are all empathetic human beings. Being gentle to yourself, have a self-care plan ready, which allowed you to respond to different situations from a stable, grounded place is very important. And here are some self-care tips. Be gentle to yourself. You are not going to be able to do everything you hope to each day. Build a pool of resources as you are able. Caring for yourself does not have to be a solo journey. Finding a mental health professional that is good, fit for you, can go a long way toward building short and long-term coping skills. If you need to debrief with someone, you can debrief your supervisor or like any professional or any friend, but remember not to share confidential information, but at all means, you can say that you receive a disclosure and you can talk about the impacts that happen to you, and connection with loved ones who are compassionate and supportive can also be very helpful. And continuing education and professional development, this is a very important self-care plan because sometimes we need more information or to educate about ourselves, have more training about the topic in order to feel that we have the skills and we have the tools to respond. So I think this is the end of the presentation. And yeah, the references, and I have more, but I didn't include them here. So now I leave it to Sarah.
Thank you. Well, from me and also from the team at AVA and the team at Resolve Alberta, thank you so much for sharing such important knowledge and wisdom with us today. I particularly enjoyed those really practical but often overlooked tips around things like eye contact, the language we use, how we invite people to share things with us, and those self-care tips. So thank you so much. At this point, I'll open up the floor to questions from the audience. I know that Katie had a question that says, is anyone else experiencing kind of mid-presentation? Katie, would you like to add anything else to your question?
Sorry, no, that